Hello, my name is Conica Williams. I'm an LPN to BSN student at Indiana State University, and today for my Nursing 444 Community Health Nursing course, I will be discussing hypertension or high blood pressure for my health education program. Population at risk. We will begin by establishing the population at risk. African Americans are the population at risk. African Americans tend to develop hypertension most often. Hypertension is typically more severe in African Americans, and medications are less effective. At the bottom of the screen are several links. At this time, please pause the video and take a moment to follow the link labeled Pre-Test to answer a few questions about hypertension before moving forward with the video. Objectives. Upon completion of this video, you will be able to first define hypertension. You will be able to identify risk factors associated with hypertension. You will be able to identify signs and symptoms of hypertension, identify complications of hypertension, and lastly, you will be able to list preventative methods for hypertension. What is hypertension? Hypertension is the long-term exertion of force against the artery walls. Arteries are involved in circulation and function by carrying blood away from the heart to the rest of the body. There are two types of hypertension, primary and secondary. Primary hypertension is the most common and has an unknown cause, while secondary hypertension is related to other underlying chronic illnesses. Normal blood pressure is less than 120/80. Hypertension is a blood pressure reading of 130/90 or higher. Hypertensive crisis is 180/110 or higher. Pictured to the right is a chart that gives you a visual of what normal, elevated, stage 1 and stage 2 hypertension is. Risk factors. As mentioned earlier, African Americans are a population at risk. Therefore, the first risk factor listed is race. Next to consider are age and family history, unhealthy diets, lack of physical activity, alcohol consumption, tobacco use, stress, and chronic diseases such as diabetes mellitus and high cholesterol are also risk factors for developing high blood pressure. Signs and symptoms. Hypertension or high blood pressure is commonly known as the silent killer. It is known as the silent killer because individuals that develop high blood pressure rarely ever show any signs or symptoms. Individuals who do experience or exhibit signs and symptoms usually complain of headaches, experiencing lightheadedness, having altered vision, and many times when the blood pressure is extremely high, individuals may have nosebleeds. Complications of hypertension. Hypertension tends to put a lot of wear and tear on the heart and arteries, as well as other body systems, such as the kidneys. Complications include heart attack, stroke, chronic kidney disease, or heart failure. Prevention. Primary preventions for high blood pressure include diet changes, increasing physical activity, and limiting alcohol consumption and tobacco use. The goal of primary preventions are to stop the development of high blood pressure altogether. Next are secondary preventions. Secondary preventions include maintaining a healthy weight through diet and exercise, avoiding alcohol and tobacco use, and screening for other underlying chronic diseases that may contribute to high blood pressure. Many times, physicians attempt to control elevated blood pressures with diet and exercise before putting individuals on medication. Therefore, secondary preventions are geared towards individuals who are considered prehypertensive and have had consecutive blood pressure readings of 120 to 129 over 80. Next are tertiary preventions. Tertiary preventions include medication and treating other chronic illnesses such as diabetes, high cholesterol, or renal failure. Tertiary preventions are put in place to control blood pressure with medication as diet and exercise changes did not work, as well as treating the underlying diseases that contribute to or are caused by high blood pressure. This concludes my presentation. At this time, I would like for you to pause the video again and take a moment to revisit those links and follow the link labeled post-test to show what you've learned. Thank you for taking the time to watch my presentation. I hope that you learned something new today. Pictured here are a copy of my references.